Hello, everyone. It's Nurse Linda here. It's nice to see you today, or at least to be with you today. I can't see you, but it's nice to be with you today. I hope you can see me. I'm not on the big screen. I seem to be on a little picture up here, so maybe Kelly can rearrange that. I don't know why I'm not on the big screen, but anyway, I'm Nurse Linda, and I am a lightly pigmented skinned woman with brown hair, and I have on my clear glasses today, and I have on a green dress with some black figures in it today. So that's who I am. And I want to welcome you to the show today. It's very nice to have you with us. First of all, I want to mention we have, through the Christopher and Dana Reeve Foundation, we have um, we have a lot of resources that are available to you. And so I want to talk a little bit about I want to talk to you a little bit about some of the resources that are available. So, there's all kinds of things on the website. There's uh, handout booklets that you can print out. Everything is at no cost to you. You can print out information. You can, if you want the booklet itself, you can get a booklet, and there's a lot of blogging information from different people. You can connect with advocacy groups, and being election time coming up, you might want to think about becoming an advocate. Now, that doesn't mean you have to go out and hand out flyers or talk to Congress people. You can, that's a part of the advocacy program. But if you just want to follow along and see what advocacy is for a while and different programs that you can support, they have a wonderful service. When you sign up, they will send you a notification that there's a bill coming up in Congress, and then you can put in your information, and that they have a sample letter, or you can send your own letter to your congressional representatives for your state just by hitting a button, and it automatically goes, which is a wonderful thing because our elected officials really do want to know what's on the minds of the people that they serve. And so if you want to send that formatted letter, and say in your state, if you got like 10,000 letters, well, the senator or the representative is really going to pay attention to that, because there's 10,000 people in their state that are really want advocacy for this particular healthcare program. So there's just a lot of wonderful things you can do. There's the mentoring program. If you're a vet, there's a program for vets. And also, there's this thing called the National Paralysis Resource Center. And it is really very important. They have people there from 7 a.m. to midnight ready to take your call, or you can schedule a call and they will call you at your convenience. And they have answers to everything. They're highly educated, highly trained individuals, and they're just able to answer about any question you could possibly have. Now, if you do want to call them, their number is 1-800-539-7309, and it will pop up in the chat box how you can contact them. You can go to the website, search on information specialist, and then you'll be able to find that. Another thing that we have are these really handy dandy wallet cards. And I know you can't see these or read these, right now, but there's a lot of information. They're made to fit in your wallet. So they're a trifold like this. And so they're the size of a dollar bill. So they fit in your wallet. There's one on sepsis, deep vein thrombosis, and autonomic dysreflexia. And they're kind of cool because you can put your personal information on the back of here. Now, this one is one that's got a coating on it. You can order these from the Reeve Foundation, or you can just print these off. And I always tell everybody, if you have paralysis, get these cards, and they're in a lot of different languages. The AD card comes one for adult and one for children, but they're in a lot of different languages. So if you go to that web page, you can really you can just print these off. And I say, hand them out like candy. If you go to the emergency room, give them, and you think maybe you have sepsis, pull out your sepsis card. Come with you can print off as many copies as you want. There's, no limit. So come with your come with your bag ready for the hospital and put some of these cards in there. So if you think you have sepsis, the way sepsis is diagnosed is by going going from the least all diagnosis is going from the least problem up into the most complicated problem. Sepsis is a high level complicated problem. So this has information, as all the cards do, they have information about what sepsis is. On the inside, there's the signs and symptoms of sepsis for you. And on one of these flaps, there's information for your healthcare professional. Now, because sepsis is such a complicated issue, they're not thinking about that automatically when you go in. Sometimes sepsis has some symptoms that you might notice. Sometimes there's not really any symptoms. Sometimes people just, kind of feel a little unusual. But if you have had an infection that you know about, sepsis sometimes follows after that infection. So maybe you got a urinary tract infection, maybe a respiratory infection, or maybe you just had an infection on your skin. You got you bumped your hand and it cut and it got a little infected. You've already been treated for that. And sometimes that infection lingers in your body and it will travel around in your body and it will appear as sepsis. So it's very important that if you think you have sepsis, anybody who walks into that room, the doctor, the nurse, um, the person taking your registration, the housekeeper say, I think I might have sepsis. I think I might have sepsis. To put it in their mind so they start thinking up here instead of working through all the different things, because you want to have that sepsis treated as quickly as possible. So all this information is in there. The same with AD. When you go to the emergency room, people might not know about AD. If you have a child in school, the educators might not know, the school nurse might not know about AD. Again, there's a place where you can put your information on the back, and then also deep vein thrombosis, because these are all can be emergency conditions. And so, it's kind of nice to have that, sometimes healthcare professionals don't want to be told what to do. They don't want the patient to come in and tell them what to do. We've all experienced that. If you have paralysis or you don't, we've all experienced that. So if you think you might have something, these cards are very helpful. The information to the provider is written in a very nice, productive way. So it's very, kind of a non-threatening kind of thing. And then the information, the research that says this is what the protocol is, here are the articles. So if they want to look up the article for, the proper treatment, it's all there on the card. So I just love them to death. So I always say, hand them out like candy, give them to everybody you know. If you have a provider coming in to, do your bath, give them these cards so that they know what's going on. If you get admitted to the hospital, I say tape that card to the wall at the head of your bed. Tape it to the head of your bed so that people coming in will see that and notice that and be able to pick up on these different things that you might be having issue with. So it is National Sepsis Month. Sepsis is a very tricky kind of condition. People get septic and they can be treated. It's when this infection starts floating around in your body. It doesn't stay in the place where you had the original infection. It can affect your major organs and you can have a lot of complications. It can affect your extremities where it's not getting enough blood flow to like the fingers and the toes and then working up the extremities. So it can affect a lot of different parts of your body. So if you become septic, you want to be treated right away so you don't get into septic shock, which is the later version of that. So be sure and get those cards because they're wonderful. If you have any questions, you can call the PRC and talk to people. If you want, they have information about, I always get a lot of questions about how can I get equipment that I want that insurance doesn't pay for. And that is a very complicated process. And so they have a handout all about how to get this kind of equipment and stuff. If you're not sure where to go, if you're a newly injured person and you're not sure what facility to go to for your rehab, they can help guide you through some of those questions. If you've been injured for a long time and you're having some changes in your body, So I know there was a question that somebody wrote in that they have been continent and now they're older, they're in their 60s and they're having some accidents and whoa, what's this all about? And could this be due to aging? And yes, that is the answer. It probably is if you've been continent for that long a time and if you don't have an infection, so there are different things. If you're a woman, there's a lot of information about women's health and paralysis on the site, as well as the information specialist can help you kind of wade through some of this information. On another note, I had a wonderful weekend last weekend because Saturday I went to see the Superman movie, which is a documentary about the life of Christopher and really Dana Reeve. And for me, it was so wonderful because I knew both of them very well and from being involved in his recovery project. And so it was kind of a little fun walk down memory lane about all the wonderful things that both of them did to help people with paralysis. And it's a lot about his recovery program, which I was very actively involved in. And there's some movies, some very short video clips in this documentary showing him moving his foot, showing him in the water where he's seated and able on his own to lift his bottom up off the seat. And you'll see him going up and down on the because the buoyancy of the water helps. But he could move every muscle in his body, some against gravity and some not so much against gravity, but he really had a remarkable recovery. And so it's kind of very motivating to see what he did and what he did for the people, starting out with people in who had paralysis or with spinal cord injury, moving into the whole world of paralysis. So if you had a head injury, if you had a stroke, if you had paralysis from a disease, advocating for people with all kinds of paralysis, and then moving on to take on the insurance companies, which was his project that he was working on. So, just watching this whole progression and hearing from his family and hearing from friends about what a determined man he was. And boy, he really was. And he really was just a terrific individual. So I really enjoyed that. I know it's going to be in the theaters for a short time. And I don't know this for a fact, but at the beginning they had HBO supported by help HBO helped make it and the movie and CNN documentaries help support the making of the movie. So I'm cautiously optimistic that it will be on probably both of those channels at some point in time. So if you missed it in the movie theater, you'll be able to see it later. But what a thrill it was for me personally, and what a terrific movie! I highly recommended, highly recommended by Nurse Linda. It was just fabulous. So if you get a chance, be sure and see that movie. And the Reeve Foundation is made up of really two sections that work together, but there are two sections. I call it the Christopher part is the research part. He was really interested in research, really wanted to find the cure. And as a person with spinal cord injury, you could understand that he would really be interested in one thing they didn't mention in the movie was that he traveled to different places in the world. Now, if you have paralysis, you know how hard it is sometimes to travel to different places. But I remember at one time he was planning his trip to Israel to go talk to researchers there because they were doing some fabulous work in repair of the spinal cord. And so he went there and he was knowledgeable. It wasn't like just, okay, tell me about what you're doing. I mean, he was like totally prepared. Followed the research very intently and really had a good handle on all that was going on. And then the other part is the National Paralysis Center, which I call the Dana part. So that is the part where, okay, now you have paralysis. Okay, what are you going to do about it? So we have the looking to the future and we have the living in the here and now. And so that's what we're talking about is living in the here and now, what kinds of things we can do, like get the sepsis card and these wallet cards, look up information about yourself. And I know a lot of you do that and call the paralysis uh, resource center if you have any questions. Now, there's another thing I wanted to talk about today because I get a lot of questions about it. And so I really wanted to talk a bit about weight loss surgeries and weight loss medications. Not so much just surgeries, but more the weight loss medications. Because, oh my gosh, if you go anywhere, if you talk to somebody, and you see somebody that's lost weight and you get talking about it, or maybe they just bring it up to you, oh, I'm taking this drug. Turn on TV. Oh my gosh, the commercials. People are dancing and smiling because it's so great and fabulous and so easy. And so people will ask me, well, I have paralysis. Can I take these drugs? And there's not really been a lot of research on these drugs in people in paralysis. So it's been kind of difficult to talk about, but there are some things that we do need to know about it. Well, first of all, let me talk about the weight loss surgery. So there's the bypass surgery, which reroutes your intestines so that it kind of bypasses and food just passes through your system really much faster. So all the nutrients, i.e., calories, can't be taken out of the food. And then there are other people that get the gastrectomy where they take, your stomach is kind of uh, half deflated football shape. It's kind of shorter on the top and then it kind of has a pouch that goes down along the bottom. And they remove that pouch part so your stomach becomes more like a tube. Now, way back at the beginning of the professional webinars, we had Dr. David Gator, who was the head of the Miami project in Florida, and his research, he treated patients. He was the head of the program, and but he did research also, and he did research on metabolism. And so if you go back into the YouTube channel, you can see him. I say was the head because he has since passed on, which was such a great loss because he was again like Christopher Reeve. Not only was he great for the community, a great doctor, a great researcher, a great administrator, but also had the personality of gold. I mean, he was just gold at everything and was a wonderful man. But we did ask during that professional webinar with him, Dr. David Gator, and you can go on the YouTube channel and look up any of the professional webinars. Therefore, they're done by people who are tops in the field in whatever it is they're studying, and it will have something to do with paralysis, of course. And so it's bringing that healthcare professional to you so you have access to the people who are top in the field. And so Dr. David Gator did the first one. And so I asked him with metabolism, what about these weight loss surgeries? And he said, well, the big concern is that once you have the weight loss surgery, that there are bowel implications in that the food moves through so much faster that your bowel program might not be able to control that. And so his concern was about having bowel issues and not being able to control those bowel issues with your bowel program. And then the other part of it also is there's a lot of diet that you have to follow, which might not be the right diet for you, depending on what your issues are with your paralysis. So you might have certain dietary restrictions. You might not be able to consume the amount of protein that you need to get in to keep your body healthy. So being all into metabolism, he was worried about the diet part, the bowel part, but also there's exercise that's required to be done after that. And people with paralysis might not be able to do the exercise up to the amount of exercise that's needed after some of these surgeries. Now, if we had more research and information on this, and people are starting to study this in specialty populations, so at least we've got that going for us. But he was not so keen at the time, and that's been now a year and a half ago, but he was not so keen on some of these surgeries. And, I think those are very reasonable things to think about. It doesn't mean that I'm saying you should not have these surgeries. You need to talk about this with your doctor and see, really work it through for you as the unique individual that you are, because everybody has a little something different than the person next to them. It doesn't matter if you have the same level of injury at the same time and you're the same age. Everybody has their own unique situation. So I talk to your doctor if you're thinking about weight loss surgery. Talk to your doctor about those three things. Will I be able to follow the diet that's needed? Will I be able to do the exercise that's needed? And will I be able to control my bowels through my bowel program? And how will that work out? So those are the three things, and it might be wait and see. They might say, "Oh no, you're fine." I don't know what your personal healthcare provider will say, but I would talk to them about those three things. I know people a while back they were more interested in weight loss surgery than they are now, because now there are all these weight loss drugs. So let's talk about those for a few minutes. So there are many, many different types, and they work on different centers in the brain. So if you have a disease or if you have a brain injury or stroke, and you're thinking about some of these drugs that you might want to try, be sure and talk with the doctor about how it works in the brain. So if you've had a stroke or you have, say, MS, and it's affected a certain part of your brain, and that particular weight loss drug works on that part of your brain, but that part of your brain's not working as it should, then it might be taking the drug for nothing, or it might work differently because maybe that part of your brain is working somewhat or something. So be sure and get the drug that will work in the brain part of your brain that is working as it should be working. So that would be a first thing to think about. Now, another thing to think about is that a lot of these drugs uh, cause diarrhea when you first start taking them. And uh, I read the brochures on these drugs, that little insert that comes in all your medication, and it's from the company, it's got the chemical formula and all that stuff on it. But I read the side effects and the risk of taking any of these drugs, and I'll look it up on the computer. So it's, free information. You can get it even if you don't have a prescription. You can look ahead of time and you can look at what these different drugs are and how they work. There's a lot of information on the uh, computer about these drugs. Some are from places that are maybe not so reputable. So look up the product information from the company that makes the drug, because that's where you're going to see the information about the side effects. They're required by law to put it on that piece of paper. So you can look all these up if you so choose. I mean, I enjoy doing that kind of research. So, for me it's not a problem. But if you're interested, start thinking about what the problems might be. So there are some drugs that will give you diarrhea for the first couple of weeks, but it might last longer than the first couple of weeks. So having, a lot of diarrhea can affect your skin. It's going to affect your bowel. It's going to affect how the food is moving through your gut for your digestion. So that is a huge issue with the bowel. If you have neurogenic bowel in particular, your bowel is slowed down working. So, 60% of people with head injury or stroke have a neurogenic bowel. And if you have a spinal cord injury, most of the people, some incomplete people, don't have that much bowel effects, but generally speaking, people with spinal cord injury have neurogenic bowel. And then if you have a disease process causing your paralysis, you might have neurogenic bowel. Neurogenic bowel works very, very slowly. It processes food very, 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 very slowly. So your bowel is working at a very slow rate. Many of these drugs work because they slow your bowel so you always feel full. And that's the process by the way they work. So they're going to make your bowel work slower. If your bowel already works slower, you can end up with a paralyzed bowel. And those don't always return to function. and it's a huge problem. So thinking about how the drug works in your bowel is going to be critical if you have bowel issues anyway. So you could start out with diarrhea, you could end up with a bowel that's paralyzed or anywhere in between. And so that is a huge problem. So, all these people, oh, it's so fabulous. I lost all this weight. Congratulate them. That's great for them. But really take it very seriously when you're going to think about taking a medication that's going to do this kind of thing. Now, there is one older weight loss drug, uh, Orlistat. It came out quite a number of years ago. It's one of the original weight loss drugs that came out, and it works differently from the other drugs in that it doesn't let your bowel metabolize oils, grease, anything like that. And I remember when it first came out, they advertised about, oh, if you eat too many potato chips, you'll have these oily bowel movements and you could be incontinent. And you couldn't eat anything with oil. And this was years ago. You couldn't eat anything with oil because you could be incontinent. Now, you might not have paralysis. You're just a person out, living their life. And if they would take this drug, they could have an incontinency, like at work or something. And so it was kind of like a little scary. It's a little bit threatening about eating this oil. But anyway, it's still on the market, and that is a drug that works differently than the other new drugs that are out that work differently, controlling your hormones differently. But that is one. But then, of course, you have these really oily bowel movements. So that might be an option for somebody who has neurogenic bowel because it's not going to absorb the oil. So the stool is going to move through faster. Now, I recommend nothing. I just provide information that you might want to talk to your healthcare professional about. Oh, I heard there's this one that might work for me. So, it's something again. Now, if you do have these oily bowel movements, you could be incontinent again for different reasons, but you could have more incontinence. And then there's another old time, one of the original weight loss drugs that came out. There was a program called FinFin, and it was two drugs. They both started with the name Fin, so they called it FinFin. And the one drug, the one Fin in the FinFin, um, caused heart problems, and so people had a lot of cardiac problems from taking that medication long term. So they dropped the Fin, and now they just have phentermine, which is a drug that some people take. It works differently than these other GLP-1 drugs they call. Those are the I'm going to say product names because the brand names or the generic names uh, are not really out in our common terminology now. So I'm going to say brand names, but it works differently than the Wegovy, the Ozempic, Manjaro, Zepbound is another one. Sex Vita is another one. Contrave is one. So it works a little bit differently. The phentermine works differently. And so that might be an option too. So again, you have to think about all these things. If you're thinking about one of these drugs, look up the product label so the product information sheet so you can see what it is and think about it. Now, no matter what drug you might choose, if you decide you're going to go ahead and do this, um, and your doctor, encourages you. Now, warning, you can go on the computer and just say, give me some of this drug, and they'll send it to you. Now, there's a little more to it, but these drugs are not hard to get. They are expensive. Wow, they are expensive. So, but I would not recommend getting one off the computer or ordering it from some over the computer kind of thing. Talk to your doctor who knows you and your issues, your healthcare issues. That's going to be critical because they might see something that I haven't mentioned, or and so it's important that you have somebody that you can then contact and say, I haven't had a bowel movement in 4 days. I've been doing my bowel program, nothing, red alert. You're going to have an impaction. So you want to have this follow-up care. It's going to be very, very critically important to you. So the other thing about the weight loss drugs is, again, you have to follow that diet, like with the surgeries. You have to follow a low calorie diet, and that might be hard to do. Now, I know some people who have paralysis, it's hard for them to eat because their bowel is slow. Their stomach always feels full anyway, and so they usually are not overweight people. They're usually extremely thin. Some people need to adjust their diet because they get that little pouch in their stomach, and people call it their pouch. um, it's just, it's not so much from fat as it is from the abdominal muscles are not functioning. So they're not able to hold your intestines in as well. And so they kind of pooch out. It's not a hernia, it's not anything like that. It's just that your body just kind of shapes that way. But a lot of people don't like that little pouch and they think, oh, I need to go on some of these drugs and I'll get rid of my little pouch. That probably will not work that way for the little pouch because it's not fat that's collected there. There's always some fat everywhere in your body, but it's not so much fat as it is, more of your internal organs because your muscles aren't holding in as tightly as they worked before maybe your paralysis. So, it's don't think, well, that's going to go away with these weight loss drugs because it's a different issue altogether. But you might need us to, and if you do have that little pouch, you can follow uh, a different diet to help from getting the bloat because the pouch gets bigger. The way your intestines work is it's metabolizing your food, which creates gas. And the children's book, The Gas We Pass, everybody makes gas. That's the way your food is digested. That's how it works. So if you have a meal that makes a lot of gas in your intestines, your little pouch is going to be bigger than when you haven't eaten that kind of food. So there's all kinds of diet modifications that you might be on anyway, and then to try to get all of this special diet, lower calorie for your diet might not give you, again, the protein and the nutrients that you need to maintain your body. Okay, and then the other thing is the exercise that goes along with these weight loss drugs. And you have to do a certain amount of exercise to get the maximum benefit. Now, some people don't do much exercise. The weight loss drugs still work in their body, but the more you can exercise, the better these drugs are going to work. The more you exercise, the more your bowel is stimulated. So if your legs aren't moving, moving your legs are very important to exercise because your biggest muscles in your body are in your thighs. So getting those thighs activated is very important to your general health with movement because as you're moving, that is metabolizing the most glucose in your body. And because those muscles are so big. And so one of the problems with paralysis is the development of type 2 diabetes. Maybe not because of the food that you're eating, but because your body's not metabolizing as much glucose because you're not moving your legs as much. So it's important to think about, oh, how am I going to move my legs to make my metabolism better? Because now I'm on this weight loss drug. So you can have somebody move your legs for you. Now, that's going to be very labor intensive. You can move your legs yourself if you get those loops, they call them loops, which are little like handles for your legs. So they make them out of uh, like transfer belt material and you sew them so that they'll fit around your legs, attach them with a Velcro, and then they have a little handle that you sew on the side, and you can pull up with your arms. If you have arm function, you can pull up your legs and have your legs exercised in that way. You can also get them for your lower legs. You can get them for your arms if you have paralysis. Usually they're generally made. I don't know that you can, I can't imagine that you can't buy them. I haven't looked on Amazon to see, but you can get it for your arm to help exercise your arm. You can have them made. You might have to have a physical or occupational therapist to help you with figuring out how to do these. But it's just, a little strap that you make, and then you sew actually a loop on the side. Why you call it why they're called loops, and so that can help you exercise. Will that be enough exercise to create the metabolism that is beneficial for these drugs? I don't know the answer to that because it hasn't been studied. The other thing, if you have an FES bike, I would imagine you would be able to meet the exercise requirements for these drugs because you can, if you have that bike, you can get your legs spinning, get those thighs moving, okay, that's a possibility. Now, the other thing is these new functional electrical stimulators that are applied to your back over your spinal cord, piece of tape with some electrodes in there. And that helps you, can help you stand, can help you with some therapeutic walking. I call it therapeutic walking because most people, because of the proprioception and coordination, it's very hard. Plus, you're holding your body up when you're doing that. The weight is going through your legs, but you also have to hold your body up to keep it upright in space. So you have to use a walker. So will that be enough exercise to, because you're walking rather slowly. So would that be enough exercise to support the exercise requirement? Again, I don't know. I would hope so, but I don't know. I was just thinking too, I had a friend on, Ashley Barnes, who is an advocate for um, the robotic walking devices that you can wear with a battery pack on your back. And she uses that for therapeutic walking. And so would that be enough? Because the external machine is actually moving your legs. So it's like passive range of motion, even though it's propelling your body, but it's an external machine moving your legs. So would that give enough stimulation to the muscles to create some exercise? But the bikes create exercise, the robotic walkers create exercise, and the FES strip down your back creates some exercise. So you would be getting some exercise, but now none of this has been proven. So I'm just ballparking from what we know about these kinds of things and trying to put it all together. But it's some ideas to talk about with your doctor. So if you want to go on one of these weight loss drugs, talk about number one, the bowel program, because I don't want anybody to have that paralyzed bowel. That is just a nightmare. So we don't want that. So talk about that. The other thing is to talk about the diet and exercise because you don't want to spend it's a tremendous amount of money for these drugs. In fact, the price I heard on the TV was on a news show. I'm not sure how accurate it is, but one particular drug they mentioned was like $1,500 a month. Now, insurance will cover some of the cost of that, but still, I know some people who are paying, their insurance will get that price down to like $700 a month. So we are not talking cheap. Now, once you've met your threshold for your medication, well, after 1 month, you're practically met your threshold on medication, and you get into your different levels for your medications, that price will go down. But then when your year is up, it goes back up again. So we're talking about a significant financial investment, which I hate to think that we have to determine our health behaviors based on finances, but this is reality. So we're gonna put it out there. So anyway, think about the weight loss management. Talk to your healthcare professional. Talk about diet, exercise, and bowel, 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 because we don't want skin breakdown. We don't want diarrhea accidents. We don't want that blockage in your bowel. We don't want a paralyzed bowel. So yeah, I say these things, and I don't mean to be frightening about it, but I want people to know there are real risks with these drugs. And if you have paralysis, there are real risks as well because people who don't have paralysis can get paralysis of the bowel from taking these drugs. So if you have paralysis, you're giving yourself a double whammy. Now, maybe everything will be fine. Maybe they'll do more research. I did find one study that has recently come out, which was done on 5 individuals. Now, 5 individuals does not really tell a tale in research. But as we know with the different levels of research, you start out when you first do testing in a population, you start out with a very small number. That's what they call a phase 1 study, and that's why there were only 5 because it's the first study done in people with paralysis. And all 5 of the people, they were only on for a short duration of time, and they quote unquote did not have any complications. But also, it didn't say what was their level of injury. It didn't say how long they were injured. It didn't say what their bowel status was after their injury. So, maybe they all had colonoscopy or maybe they all had what I'm trying to think of. Maybe they all had the colon surgery. I can't even think of the word. I don't know why my mind is totally blocked on it. But maybe they had those. I doubt that they did, or they certainly would have mentioned that, I would think. But anyway, you start out in the phase 1 studies, you start out with the smallest number of people that you can collect data because those phase 1 are only to see if you live or die on this drug. That's what a phase 1 study is. Is test now they have all kinds of laboratory rat studies and animal studies and all kinds of laboratory studies before they go into the phase 1 study. But the phase 1 study is really just to see if we give this to a human, what is going to happen. So those people that do the phase 1 studies are very brave. Phase 2, they increase the number of people in a study. So they might have like 300 to 500 people in it after that. And then phase 3 is one of the levels before they go to market. And so they might have 1,000 people in a study like that. And then then there's also phase 4 studies, which is, well, we found this little complication, the side effect in the phase 3, so maybe we need to do another study in a subsection of that population, or maybe we just need to do more intensive kinds of studies than the phase 3 was. And so sometimes they do, most often they do the phase 4 studies. And then within those level, there's like phase 3A, phase 3B, phase 3C. So there, as they continue the research, there's a lot of different studies. So only having 5 is not really testing the drug so much. It's just testing to see what happens if we give this drug to certain individuals with certain characteristics. So that's what we see with that. So that is my little on the weight loss studies and the weight loss drugs. So I hope that that answers some questions. There is a Ah, so here, good question. Thank you for asking this question. Does a standing frame for a half an hour count as exercise? Yes and no. You're not really moving anything, but it does count as exercise because you're putting weight through your body. Would it count as exercise for taking a weight loss drug? No, because you're not moving your legs. So that's kind of a gray area. So if you would ask me, Linda, I do a standing frame, is that exercise? We would normally say, yes, that is a form of exercise because you're putting weight through your long bones. Having a lot of advantages. You're helping your body in a lot of different ways. You're standing up, your breathing's different because your diaphragm is more easily able to be pulled down. So there's a lot of exercise benefits with using a standing frame. But is it enough exercise for the weight loss drugs? I would have to say probably not. But again, there's no study, there's no research to tell me in paralysis, is this way or is this not this way? So thank you very much for that question because I overlooked the standing frame. And I love standing frames. I think everybody should have one. If you can have one, talk to your doctor about it. Most insurances cover the standing frame now. Even Medicaid in all the different states will cover a standing frame. And a lot of people don't know about that. And it can really help with a lot of different things. Plus, you're up high with everybody else, and so people have a big psychological boost when maybe they haven't seen themselves standing high. I see some patients get in the standing frame for the first time, and they have a really emotional reaction to it because they look at themselves in the mirror in the therapy center, and they're like, "Oh, I'm standing." And the families have huge emotional reactions to the standing frame. It's really beneficial to your psychological well-being. Now, uh, they're not as hard to get as they used to be. They're really getting approved a lot more. There are options that you can get on the standing frame, and this might be something to think about. So one of the options is if you have arm function, they have gliders, like, if you see that exerciser on TV where the person's gliding like they're skiing and they're using their arms. Some standing frames come with an arm option that will help move your arms. And then, or you can use your arms to propel your legs in tandem with your arm movement. And those are really cool because that gives you a little more motion in the legs. And so those are very helpful for, getting your leg muscles moving. So that's another option. Now, I don't know that your insurance will cover that option. They'll cover a basic standing frame. Some of them have a little tray table that's on the front. So while you're standing, you can be involved in some activity if you want your computer on that little tray table on the front. Or if you're somebody who's doing homework, you can do your homework on that tray table. You might take a meal standing. There that little tray is kind of nice for doing different things. In the pediatric world, a lot of these standing frames, especially, will come with little wheels on the side of the tray table, and the standing frame has wheels on it, so you can wheel around. There is an adoption and an option in the adult world for these little wheels to, kind of move you around. So, like, if you work in an office or something, you can get in your standing frame, you can wheel around, you can go for, I would say you could go for a walk, depending on, we were just talking earlier. I was talking with our little team, the team that you don't see that's behind me. There's a whole cadre of wonderful people. Zach and Kelly are there today, so they're wonderful people who make me look good. So I say thank you. But we were just talking about how the sidewalks are not really options for something like that at all times. So, if you have someplace smooth where you could operate, you could go outside. If you had a patio or in the backyard, you could wheel around on the patio or stuff. So it's another option. But again, insurance will pay for the standing frame. The options, they're a little iffy if they might get this or that. If your healthcare provider writes a letter of medical necessity and says, you know, um, this person's in school and they need this standing frame so they can participate in some particular activity or something, they might choose to pay for that. So there's a lot of different, negotiations with insurance companies. By the way, if you have not looked on the back of your insurance card, if you do not have an insurance case manager, look on the back of your insurance card and call that number and say, I have paralysis. I would like to be assigned a nurse case manager. And then you can get to know that person. Now, remember, they're working for the insurance company. But if you create a relationship with that person at the insurance company, and then, say, I need to get a standing frame. These are the reasons why. My doctor will send a letter. Is that covered? You can talk to them and they can give you some tips and some hints. And then they know that they'll be looking for that because they're your case manager now. So that letter will end up in their basket, and they know that you need that. They know why you need that. They know why it's important to you. So being friends with that person is a very crucial role that is often overlooked. People have their insurance. Oh, I got a letter, it wasn't paid for. Appeal it. As long as they say you have an appeal, you have an appeal. If it goes to your case manager, you can advocate for yourself. Your healthcare professional can call the case manager and say, this is why this is really important. It's kind of another link to helping you get things through your insurance. Now, another thing that had come up in the questions today in particular, um, was people trying to get different pieces of equipment. And you know that it's very difficult. As I said, the information specialists have all kinds of information about getting that. The case manager is one. Writing those letters of medical necessity. Now, you really want your healthcare provider to write that letter for you. A lot of people say, "Well, I know what it is, and I know why I need it, so I will write the letter myself." But your healthcare professional will put in medical reasons. They'll put in some research articles about why this is an effective piece of equipment that you need. They speak the lingo, as everybody knows who deals with the health profession. You you need somebody who speaks health profession language, that uses the right terminology, that's able to see the whole big picture. So, you might say, "Well, I need XYZ because it will help reduce my spasticity, but it will also stretch your muscles, help prevent," if you're talking about um, getting some form of exercise equipment, it will also help reduce the chance of you getting diabetes. They'll that secondary diabetes type 2. So there's all kinds of things that they will help with my breathing. It will help with this, it will help with that. So your healthcare professional will be able to just, call up all those reasons and put it in a letter, and it just kind of aids your case to have somebody who's able to put all those subsets of information in there, and so that's important. Also know that if that equipment gets approved, you maybe have seen a particular bike or standing frame or a piece of equipment that you have seen in the therapy gym, and maybe you've tried that out in your therapy gym. And so you think, well, golly, I want that piece of equipment, but your insurance company has a contract with another manufacturer. So you might not get the piece that is the piece that and you see and you really fell in love with, but you might get one that works exactly the same. It just looks different. So don't get in a panic about that. But sometimes it's like that because they get a better financial deal if they have contracts with somebody. You just need the equipment. It doesn't really matter what the brand is. So just think about that. Another question was about getting extra PT, and I like this. Is there some kind of like universal PT that comes for everybody with paralysis? And unfortunately, no, there is not. And that's one of my soapboxes, and I promised I would not get on it today. But um, there is a little caveat that a lot of people don't know about. If you've listened before, I'm repeating myself, but I really want everybody to know about this. It's a caveat that you can um, just about in any health coverage that you have, you can get 2 weeks of rehabilitation for mobility training. And that means 2 weeks. It could be one day every week for 14 weeks. It can be Monday, Wednesday, Friday. It can be one day a month. Um, it doesn't have to be 2 weeks in the calendar, 2 weeks. It's just 2 weeks of mobility training. Now, if you go to that and you want to try some of this new equipment, you can try the bike. That's mobility training. You'll have to get it approved by, your doctor will have to write the letter of medical necessity. But say you try an exercise bike and, you go one time a week for 12 to 14 weeks. And, you're showing some progress, your breathing's easier, you're able to move better, whatever it might be, your tone's down. You're not going to be walking in 2 weeks of training, but you'll learn how to use this bike, and you can talk about the benefits. Again, your doctor will be able to put in some of these cardiovascular benefits and things, that you might not stop and think about. Improvement in your skin condition, less urinary tract infections. So there's a whole lot of things to put into that letter. And so if you try that bike and then it's working for you, then you can petition for your health insurance. Well, look, I tried it and it worked, as opposed to, gee, I'd like to get a bike. I've never been on one. I don't know if it would work for me, but I'd like to have one. You're probably not going to get one that easily. also, when those letters come back, as I said before, appeal it, appeal it, appeal it. Keep appealing it. The doctor will send the letter to the insurance. The response will come to the owner of the policy. If that is you, it will be mailed to your house. If that is your spouse, it will be mailed to your spouse. If that person is a parent, it will be given to the parent. If that person is your divorced spouse who still has you on their insurance, that letter will go to your divorced spouse. So you have to know where that letter is going to go because the appeal process will have a time limit on it. You want to get that letter as quickly as you can get it in your hands and get it to your doctor's office so that they have plenty of time to appeal because doctors are busy people and they've got a lot of things to do and they really want to create a letter that is going to be really important and critical to you so that you will get what you need. So, we've covered a lot of territory today. My goodness. I hope it has been helpful to you. I hope that you'll think carefully about the weight loss drugs. I hope that we get some research done quickly that we'll be able to determine if this is going to work for people who have any kind of paralysis. And I have a lot of hopes, I guess, a lot of hopes going on here. I hope that you can all get the equipment that you need eventually. I hope the best for everybody in paralysis. And I hope eventually in my lifetime there is none and I'll retire and I'll be very happy about that. So anyway, we have lots of hopes going on. So there's some more information that just Zach just put in about standing frame. So I'd like to thank everybody for coming today. I'd like to thank you for your participation. If you have any friends that are thinking about weight loss drugs, be sure and tell them about this webinar so at least they can get some basic information and that will be helpful to everyone. So thank you for coming. If you get a chance to see the Christopher Reeve Superman movie, it's fabulous. And with that, I'll wish you a very happy weekend.